And I suppose at the outset, I really do want to commend all the wonderful work that's done by carers and by home helps throughout the country. I know them all in my own community. And in fact, this is a battle that we have fought for a long time, since 2010 even, when the drastic cuts were done to home help hours. See, I suppose what concerns me is that previous to all those cuts being done, we had a really good system. We had a system where people were employed by the HSE, they were paid a proper wage, people got their hours, they knew what they were going to get, and they knew what they could expect. So my question would be, why did you break that? Why did you break a system that was working? Now, the other thing is, there's all, home care, people being cared for in their home is so important. It's a priority for the HSE and all of that. But this doesn't speak to that. The resources that are put to it and the way that it's set up and being privatised out to private companies doesn't speak to that. So there's an imbalance between the words that are being said and how carers are treated and how the home helps are treated themselves. And I see the way I live in a rural area, running from one place to the next for a half an hour. Like, it is ridiculous. You couldn't make it up. Somebody in junior cert would fail if they sat down and they wrote that type of a prescription to deliver home care in areas, particularly in rural areas. It's bizarre. I want to ask you, in what analysis have you done into how much an hour of home help costs directly employed through the HSE and employed through one of the companies? How much are you saving per hour by not employing people, carers, directly by the HSE? And I'm sure there's been analysis done around that with all the decision making that was made around it. Now, the 6,450 people that are waiting is crazy. So if you were to provide them with, say, 4 hours of home care per week at, say, even if you are to do it through the privatised system of €26 per call, you're probably looking about 670,000 to give people, say, 4 hours across a week. So have you requested that money for it? Because you see, when we're talking numbers like that, I have one here, like a 79-year-old man being discharged from hospital. His wife has dementia, chronic pancreatic cirrhosis of the liver, diabetes and chronic arthritis. And they're told the decisions are done on a priority. So they're not a priority case. So they are a couple from this 6,450 people. And I just think that is just so wrong. So wrong.